Hi, I'm Dr. Dan Castascia with Sarasota Neurology. Today we're going to be discussing Matrix Platelet Rich Plasma therapy, and Laura was kind enough to come in today and tell us about her experience with Matrix PRP. And I want to thank you for coming in today. You're going to share with us your experience of Matrix PRP therapy for your knee pain.
Yes.
Is that correct? Right. But you had come in here, what was it, about 2 or 3 years ago?
Correct.
And you had chronic, really severe plantar fasciitis, which is a painful foot condition. Can you tell us about that a little bit?
I was having difficulty walking, pain all the time. Went to about 6 different doctors, tried many different treatments, laser, orthotics,
taping, injections of cortisone.
Yes, several injections, even with ultrasound.
Did those work for you?
No, as well as different medications.
So your pain was severe?
Yes.
On a scale of 1 to 10, how bad was your foot pain?
8.
Okay, so it was a scale of 8, barely walk, saw 6 doctors. None of the standard treatments for plantar fasciitis helped you.
No.
And then you came here to see us because you'd heard about platelet-rich plasma or PRP therapy.
Another physician recommended you.
Okay, great. Because you tried everything else except surgery, right?
You were my last resort. Right. Yes, surgery. Every doctor wanted to do surgery, and I've heard that they were not successal on your foot.
Right, the
due
failure
to all
rate.
Your nerves,
right.
yes.
The failure rate for plantar fasciitis surgery is 70-80%, and it can even make more complications. You get scarring in the bottom of your foot.
Yes.
So you came in and we talked about it, and we did PRP on which foot was it?
My left foot.
Okay, so you had left foot PRP therapy, and how did you do with that?
Great. Within 4 days, I felt release of the pain. Went back to work. I did it on a Thursday, back out to work on Monday.
Great. So there's no downtime really, or recovery time?
Not at all.
And within 3 months, how were you?
No pain, and still to this day, I have no pain.
No pain. So, you failed all these other treatments for plantar fasciitis by 6 different doctors, good doctors, and one treatment with PRP in your plantar fasciitis now about 3 years ago stayed gone. So it cured it.
Yes, and it was natural.
You had a heel spur too, right?
Yes, heel spurs, and
natural healing, that's absolutely
That's what I was looking for.
That's what you got. Okay, so tell us about your knee pain. When did that flare up last year?
September, I went to a convention on a weekend, walked a lot. Plus, I'm a teacher, so I'm on my feet all the time. By that Sunday night, it was swelling my knee, very painful. I worked 2 days. I was really limping. So I finally went to the doctor, and they didn't know what it was. I've had 2 MRIs.
Of your knee?
Yes. I went to 2 different doctors.
Orthopedic surgeons?
Correct.
Okay. So you saw 2 orthopedic surgeons. You had an MRI of your knee.
They wanted to do surgery just to look, to see
Not
what
for anything
was wrong.
specific, just to look in there?
Right.
So you would have had to have surgery just to take a look.
Right. They didn't see anything wrong.
Without going after anything specific on your MRI scan.
Yes.
Is that a little scary to think you're going to have surgery and they don't even know what they're looking for?
Yes.
That's basically what they said, right?
They thought it was something under the kneecap, which they could not see.
So it's like, if we find something, we'll fix it. But there was no guarantee.
No, they wanted to just do exploratory
But you would have had to
surgery.
go through general anesthesia.
Full surgery, yes.
Have cut on your knee, look in your knee.
Yes.
Out of work. What was the recovery time going to be? Weeks?
6 to 8 weeks.
Weeks. Not days, not hours.
Weeks. I would be out of work that long.
Miss work for 2 months.
Yes.
Probably not good for your job and employment, would it be?
Right.
So you'd already had PRP in your foot, so you came back to see us for Matrix PRP now.
Right. Again, I tried other things, medications, physical therapy. None of those worked.
Oh, so you had additional therapy. Still had a lot of knee pain and swelling?
Yes.
So you came back to see us and to see if Matrix PRP would help you.
Correct.
And I reviewed your MRI studies and examined you and felt that Matrix PRP was the answer, right?
Yes.
Certainly a lot better than having exploratory surgery is exactly what it was, with no guarantees as to outcome.
Correct. And I was so successful with my foot, I was very confident it would work again.
No downtime, not missing 6 to 8 weeks worth of work, not missing any work really.
None.
So you came in, we did Matrix PRP therapy on your, did we just do the
We did
one?
both knees, which I thought was a great idea. We did both knees.
Were you having trouble with the other knee?
No, but it makes sense to do them both.
You were concerned? Okay, so we just went ahead, because we had this one Matrix kit makes enough to do 2 knees. So we did that, and was that a painful procedure?
Not at all.
No, simple, easy?
Yes.
It's a shot, right?
Correct.
Okay, quick little shot.
Yes.
And tell us about how your affected knee, how did you do 3 or 4 days later, a week later?
4 days later, I went back to work.
No problem.
None.
Walking around,
No.
no
And it's
downtime,
been
no meds,
3 months, no medication.
braces,
No,
nothing.
nothing.
You felt fine.
Yes.
4 days, and then as the healing progressed, when was it that you realized your knee pain had essentially gone away
Say about 6 weeks.
completely?
It was totally, yes.
But I think you told me
no
earlier
pain.
that at 3 weeks you were significantly better.
Yes.
Like
After
the
a week.
pain had become intermittent then.
Yes.
But the total healing took about 6 weeks.
Correct.
And now you're what, about 2 or 3 months?
3 months.
You're 3 months, and it hasn't come back.
No pain whatsoever.
And the
no
other
swelling.
knee's fine.
Yeah.
Oh, the swelling went down too. Great. So you went back to the way you were before you hurt your knee.
Been working. I'm on my feet all day, and no pain.
And if you'd had even that exploratory surgery, you would still almost just be recovering from that, going through rehab probably now, right?
Yes. And there'd be no
Rehab.
guarantee of anything.
And you could be
Could
the
be
same or worse even.
Right.
Whereas this healed you.
Yes, it did.
Wow. So this is the second time you've had
Yes.
platelet-rich plasma therapy. What would you tell other people who were considering either arthroscopic knee surgery on their knees or shoulders, or knees in your case, or plantar fasciitis treatment? What would you tell people?
It works. And like I said, for me, it's twice. Very little downtime, and it's natural to definitely get PRP done. It's a miracle.
Simple.
Yes.
Right. Come in, get a shot, go home, and it heals by itself.
Correct.
Natural healing.
And I recommend a lot of people, yes.
That's great. Well, thank you so much
Very
for coming in
welcome.
today.
You're my favorite doctor.
Okay. Great. Thanks.